pain is a C fiber of the nerve, right?
C fiber.
What's the other thing? There's two other things. Temperature. So the perception is it's hot. Believe me, their perception is 100%. They're not wrong. But when you move the laser from one area to the other, you're going to see it's really not that hot.
Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley. Today, I have a very special guest with me, Dr. Rick Amy, who is basically laser doctor extraordinaire, and I don't just say that lightly. I've learned some laser therapies, and the techniques that I employ here at the office is from the protocols that this very smart genius doctor has created. One of the things I will say personally is that my mom, she's had a stroke, and Dr. Amy has this large protocol with the laser I've used in the office. And just to brag on you a bit, Doc, I was looking at some of the protocols, and my mom had a lot of brain fog, and she'd had a lot of issues with movement with her left side. I started using your concussion protocol, and just that, I literally had my mom's caretakers and some of the people there that work with her were saying, what happened to your mom? What did you do? Mm-hmm. And she was moving better. She was walking better. All from your therapies, your treatments in that the manual. And I'm just so thankful. So before I start just bragging on you more, thank you, Doc, for joining us today.
Oh, my pleasure. It's so fun. I had a great time. We've been here a couple of days. We got to share some things and had a lot of fun. So it's been great.
Oh, okay. So guys, I apologize for, I wanted to get Dr. Amy into another studio because we're doing some revisions here at my office. And we just hadn't got it done in time. So when I hand over the mic to Doc here, I'm going to let him do his magic. But you may hear me. I may not be as strong like with the with my voice, but I'm going to let him have the mic. But I do want to go through some questions with you, Doc. Okay?
No, absolutely. We're here to share and have fun.
Oh,
I'm just going to be talking.
Oh no. Okay. So this is like going to be with Doc here. Okay. So if you guys can hear me pretty well, next time we're going to have Doc on when he comes back into town even more. So this is not just the last one. One of the things, Doc, I really love to hear your story, and truly, you're great at telling stories and your beliefs. What brought you into this work with laser, but not just laser, your passion? What brought you into this?
Well, the laser was just something I got introduced to in 1998. So my background is a chiropractor. So I had that big neurology, sort of background in my head. Mm-hmm. And then I did the postgraduate degree with Dr. Carrick in University of San Francisco in 95, 96, 97. And so that was really, was my brain and my thinking, my thought process, or my core beliefs, if you would. And so that was really where I started. But I was also in the world with AK, right? And seeing those guys on there. So we're sort of like two different camps. And the ones that were really smart, the doctors that I really liked out there, did a combination of both. Mm-hmm. They did the neurology and they did the AK. And I thought, oh man, that's super cool. And so that's really what I wanted to do. So in 1998, I actually did an internship with Dr. Brimhall, Dr. John Brimhall. Wow. Yeah, in Phoenix. And it was great. So I go in there and he says, we're working. I usually don't let people come in the office, but he said, you can come in for a day or two and like that, and I'll show you what I'm doing. You normally didn't do that, but it helped him out at a seminar. And so I guess I earned the right to do it. So I come in there. So I'm driving for Southern California. I'm in there the first day and I'm thinking, man, there are cars from all over the country here, right? So in there, in Phoenix, we get a lot of snowbirds, right, coming back in. Yeah. But there was cars from Florida and all over the country. And it's funny. I'll tell you another story about it. The Tuesday morning wheelchair races, right? 7 o'clock. But it was really a trip. So I come in here, and by the second day, he has me a full schedule. I'm thinking, I'm supposed to be learning from you, right? You got a full schedule. This gentleman had a stroke. You need to show him the exercises and do a video. Full schedule. There was 4 chiropractors, himself. We had an acupuncturist. We had biofeedback. We had dark field microscopes. We had so many great toys, biomeridian, that. And so it was really cool, all these toys and everything. And I'm thinking, great, I'm going to have a great day. So first day, I get to spend quite a bit of time with him, right? Which is super. I'm learning a lot, especially in the AK part of it. And, he's teaching me percussion. He learned percussion from Dr. Fulford, the healing magician in Arizona there. And so that was a great part of it. But with all these people there were strokes. There were different types of people with a lot of neurological components to it. And that was my background. So I think that I'm going to be following him. The second day I was there, I walk in and I have a schedule. Right. So at 10 o'clock, I want you to see this patient. They've had a stroke. They're in from Minnesota. You need to do some videos and the other. And then at 11 o'clock, you have this and the other. And so I really joked about it. I almost had a full schedule by the third day I was there. I mean, I walked in on the board on the sheet, 8 o'clock, 9 o'clock in the other. So it was a pretty good marriage. And so I worked with him for about a year plus, and we created so many different things, so many different protocols that a lot of he's still using today out there. But the one thing that really got me to where we're going, and that's what we're talking about, is that we had a tough patient from Colorado, right? So she was down trying to get out of the snow from Colorado, and she was tough. I mean, she was tough, really. And he was working on her half the time. I was working on the half the time. But she kept talking about this laser, right? This cold laser. And there was a doctor in Colorado that had these helium neon Swiss lasers. So you laid underneath them, and they were light, and they went like this. They looked like Star Wars and that. And I said, we're going to be lecturing in Denver. We have to go out a day early, right? If it's this good and she's talking about it, it must really be good.
Yeah.
So we did. We flew out a day early. We went and saw Dr. Sternholm was his name. And he had basically a hall of fame of MRIs and x-rays. There was cars from all over the country, just like our clinic. And there were people literally lined up in pews. And he had 4 or 5 of these machines, and they were just lined up to get on the machines.
What?
Yeah, it was unbelievable. He had cerebral palsy. He had stroke patients. He had, you name it, he had it up there. So it was pretty cool. So we're saying, okay, something's going on here, right? If you travel for miles away and people are paying you cash, you're doing something right. And that's really what I learned early, is if you can get people better, they're going to travel from a long ways and they're going to pay you cash. So you didn't have to worry about that insurance at the time. Remember, we're going back 30 some years. So at that time, there was a little company called Tuco Innovations, which later became Urconia Medical. So he goes, man, these little Swiss things are very expensive. They break down. They're helium neon, so it's a gas, so it fluctuates. And so they're making these little diode lasers. And so, cool. Well, and he goes, well, we'll take 3. So I got one. He got one in his room, and then he had one to take home. And so I started using this laser, and I'm going, man, this thing's pretty cool. So I'm seeing it for pain. When I was told the protocol for treating pain is like, if you had an elbow or a shoulder problem, you laser for a minute here and a laser in the back, and then away you go, and you're going to get people better. And I said, well, that's cool. I really said that doesn't make sense, So, for instance, carpal tunnel really only originates in the wrist 20% of the time.
Yeah.
It's usually if you fall and you catch yourself and you jam it, or you need a car accident and your wrist hit the steering wheel.
Yeah.
So I said, well, there's nerve entrapments coming up from the neck down. We call these, nerve entrapments or double crush syndromes. And so I said, what if I start lasering where the problem is, right? And not just the wrist or the elbow or whatever it is. So I would check people for strength, right? Yeah. And they would go weak. And I'd say, okay, we're going to keep going weak. The more I do this, are you going to get stronger or weaker? Oh, and they tell me, oh, I'm getting weaker. I said, right. I want you to know. So I now took the laser, instead of using it just therapeutically, I could use it diagnostically. So I come to the nerve entrapment, let's say it was up here in the cervical spine, and I'd laser for 60 seconds, and then I'd come back and check. If it started to get stronger, guess what? The patient appreciated, I call this laser appreciation, right? Because you don't feel it, right? You don't feel the laser.
No,
90% of people don't feel the laser.
No.
You're sensitive to energy. I'm sensitive to energy. Certain people do feel it. So it's laser appreciation is where I start with. So you could use the laser diagnostically. So maybe it was the neck, maybe it was the coracoid brachialis, maybe it was underneath, maybe it was the two heads of the pronator teres, but usually there are multiple different ones. And so now I had the patient's attention. One, they knew that it worked, and this is what we want to know for the FDA when we did the clinical trials, because they could see the changes in strength, right? And I wasn't lasering the area. I was lasering away from it. So I think I was the first one that really applied it from a neurological aspect, really looking at through the neurological eyes and not necessarily lasering the area. And it's funny is that in clinic, 90% of the time, probably more like 99% of the time, I see things way before the research comes out. So I'm doing it, right? We're doing different things. And then back in 2002, I saw a study that came out for treating carpal tunnel, and they never lasered the wrist. They only lasered the thoracic spine T1, T2, T3. Right?
Wow.
So I'm thinking, oh, that's great. So the upper thoracic, a little bit of the cervical there, and they got great results. In fact, we just did a pilot study with Avant, and I did a 6-minute protocol, only 2 minutes on the wrist, right? Just 2 minutes. So I'm doing neck, right? We're coming up here. We got another entrapment. We're doing just 3 different points to it. 2 minutes on each spot, 6 minutes total, phenomenal results. 18% increase in grip strength in one treatment, right?
Wow.
Decreased numbing, decreased pain, decreased other things. Now, pain and tingling and numbness, they're pretty subjective for me, right? Because it's your perception, right?
Totally,
My pain is different than your pain, different than a lot of people's pain, different than a hockey player, middle linebacker in the NFL or whoever. They're all different. So it's subjective. So we took that information and everything, and then we actually hit a point where the FDA was going to close us down.
What?
They're saying, no more, you can't sell any more laser because it was not cleared. So people have been trying to get laser approved in the United States for probably 30, maybe 40 years, right? So it'd been a long time, but they're all going on pain, which is subjective. So I said, well, okay, so we can't really we got to use pain, right? Because that's coming into it. So I said, well, at that time, we were doing a lot of things with MyLogix, right? Dr. McCoy, and they had computerized range of motion and muscle strength testing. So we started lasering patients and seeing a change on the computers on muscle strength and range of motion, which was the AMA guidelines for pain and disability. I said, oh, we're going to take a page out of the AMA guidelines. So we took a page out of the AMA guidelines. We looked at pain, we looked at range of motion, we looked at muscle strength. So I could have done anywhere in the body, right? I could have done, low back, but why are I going to do low back? It's weight bearing and I'm not going to see a big change of range of motion. So I chose to do the neck and the shoulder because the shoulder, as you know, is just the balance between the anterior muscles and the posterior muscles. And once you balance them, guess what? Your range of motion goes crazy, right? You get that clavicle from rotating out of the way. And so that's what I chose to do. So we did 100 patient, double-blind, randomized placebo studies. But I also know a point with the laser is if you're lasering the area and you do movement, guess what? They get even better. So we laser the neurology, we laser the area, and then we do movements. And now lots of times we do other modalities in combination with the laser.
Wow.
So we do it. We get great, really phenomenal results. And again, we're a small little company, right? And so we designed it and we had a lot of help with it. We did not know things. So guess what? The people that had placebo lasers, right? LEDs is what we use for the placebo lasers. Guess what? When you're moving it and you're getting placebo, their pain went up, which is normal. But you need to have at least a 30% placebo. So if you can believe this, our placebo was too low. They said, your placebo's too low. It's too good to be true. He said, you got to do it again. We're like, what?
Got to do it again.
Got to do it again. Got to do another 100 patients again. So we're not moving. Don't move, right? Don't move the shoulder. Don't move your neck. Don't do anything like that. We came back. Everything fell in line. And it was really great. So it took us 2 years of clinical trials, a little over 2 years. And then we flew back there and we talked to them. So they're pretty good about certain things. And then we were the first, to get approval. So I wrote the protocols for that. I worked in the clinics that did it. And so it was a lot of fun, but it was a lot of work work. I'm a clinician. I'm a numbers guy in my head, but not on paper and keeping track. And, it's like a lottery. Okay, placebo, real laser, placebo. So we had to call in, right? We had to find out what you're doing.
Wow.
But it was really the key is that because you don't feel that laser, you need to know changes. And I know I love it for the patient to see that changes in strength, especially and range of motion, because they understand the power of it. And I think that's the hardest part is that I was told for so many years that it's just a glorified flashlight.
Yeah.
And I tell them how it works. Oh, we're going to stimulate the mitochondrial DNA. The DNA is increasing ATP. ATP is important for muscle contraction. You need just as much ATP to relax the muscle. And I talk about that, and they go, it can't work like that. I'm thinking, that's the way it says it in the books.
That's what it's supposed to.
That's what they say in the books and what we had at the time. So I have heard that it can't work, haven't worked all my life, right? Yeah. And so now we're 25 years later, we have 10,000 PubMed articles on laser therapy.
No way.
Yeah. So now the research is in, and we can't say, oh, it doesn't work, anything like that, which is just really nonsense. So we have the thing. But in the old days, I'd have to go to the universities, right? To
go and get the information.
Get the information. So there's probably the main one is lasers in surgery and medicine, right? So you go find the copies of that. Did I get last month? Did they get it in? Did I get the other? And then you find it and you search through all the articles. Oh man, that one's a really good one for what we're doing. So most of them were based on wound healing and pain. Those were the two big things at that arena. And so I said, oh, that's a good pain one and the other. And so then you photocopy it, right? Then you take it out and you photocopy it and you put it in the manuals or the books that I was teaching with. Yep. So they had some information. So I'm coming from the Stone Age, right?
Well, I mean, like just the idea that you had to go to the library and to get it all out.
There was nothing. There wasn't very much on it. I mean, there was very little research. So again, I knew it was working, right?
Yeah.
You couldn't deny that it wasn't working. My patients knew it working. The things we were getting with pain and neuropathies and headaches, and then we started getting a lot of things with immune diseases was really phenomenal. So again, as clinicians, we usually know first, and then the research catches up to us.
Because you have to do like that many, that long, 2 years shows how much intensity you put into lasers. When you, you're a young clinician, you're coming out and you're doing this. Some people may not know, but I'm not trying to backtrack. So everybody, what? You're saying mitochondria and ADP and lasers, but really people don't know what it does. Is that can you give us a brief description, like how it goes into a cell and turns it on? Or
yeah, I mean, we've learned so much. We really have.
Yeah.
The number one thing is that if you see strength and you see ranges of motion increase, you know that you're increasing ATP to relax the muscle and to close the pain gate, right? So when you see that good motion, so now we know. And really, I grew up birthed on the red laser. That's what we had in the beginning, or what I used in the beginning. So it was very special to me. But there was some phenomenal research out of Russia that really said when a cell replicates, it emits light at a waveform between 630 and 640 nanometers.
Wow.
So I'm backstepping just a little bit. So we love that 635, 637, right? So your skin cell, your muscle cell, your tendon, your cartilage, your organs are all replicating. So when they replicate, they emit light at that particular waveform. So to me, it's the true biomodulator. And so that's really what we're doing. Yeah. In the old days, it was cold lasers, low-level lasers and that. But now they changed it. J.J. Andrews and her group did it, I think about 8 years ago now, to really what it does, photobiomodulation, which means it takes something that's inflamed, right, or overactive cells, and it brings it down.
Oh, I did not know that.
And then if you have a chronic condition and you have a decreased metabolic rate, it brings it up. So the true meaning of lasers, photobiomodulation, I love the red. Now, the red has an affinity for the cytochrome C, which is way over my head, but it's on the cell membranes in the mitochondria, right? So when it hits it, we're shooting photons into the body.
Yeah.
So when that photon is shot into the body, it needs something to catch it, right?
Yeah.
So that cytochrome C is the receptor site or the catcher.
Oh, so it catches that
Yeah,
red light.
it catches it. So it's an acceptor, right?
Yeah.
So when it hits that acceptor, it gives all its energy up to the cell. So we're using quantum energies,
Yep.
right, that work at a level that increase the mitochondrial ATP, and there's thousands of those on the cell, as you know.
Yes.
Okay. So that's really the thing. So what happens if the cell has more energy? What are some of the things it can do?
I mean, increase healing and in, like basic proliferation, using cell growth, things of that. Accept more nutrients, get rid
accept
of
more nutrients, and detoxify itself, right?
Mm-hmm.
Those are the two big things it really does. You know, you bring in nutrition and we detoxify the cell. But the big things it really is a cellular communication, which is the cool thing, the cool stuff, right? Yeah. So we increase free radical damage. It is one of the few things that you can create energy without causing really any free radicals, right? Oh. So you're creating energy, but not having all the other things. Because
so when you with all the other things, like real quick, like people with free radicals would be like they could damage the cell if they're like because they
absolutely.
Okay.
Yeah, free radicals are aging process. So you need it. You know, there's a combination. So you need to create energy, but there is a consequence to that. Just like when we're breathing, most of our toxins are gone through, released and transferred through the breath, right? Yes. So it's really breathing, and then the skin, and then we come into the liver, gallbladder, and out through the kidneys. So that increase in energy. Mm-hmm. Does a couple things. When you have a cell that's not healthy, right, it's not perfectly round and plump and looks like a grape, right?
Yeah.
It gets deformed, right? It does. So how many receptors can you get on a deformed really cell? Not many. So you need to give it the energy. Pump this out, get the good stuff in, the bad stuff out, make it more plump, get more receptor space onto it, and you're going to have a healthier cell. All cells in the body replicate, as we're talking about, right? Skin cell, 28 to 35 days.
Yep.
Muscle, full life, 2 half-lives, about 3 weeks. We are looking at joints or tendons. Those are cartilage. Yeah. They don't get much blood supply.
Yep.
So anything gets poor blood supply is going to take longer. We're looking at 3 to 6 months.
Wow.
Right? So it's just based on physiology. Yeah. But every cell in the body, no matter what type of cell it is going to heal 25 to 35% faster than normal. So that's why we can see it on the wound healing with the burns and everything. It's so cool. If I can get an athlete early, like, so you were out doing some type of activity, let's say you were skiing, you twisted, you hurt your knee in a bad fall. If I can get you immediately, and this is what we do with world-class athletes, we start lasering immediately. So the laser does not eliminate, and this is sort of a misconception now, it doesn't eliminate inflammation. Mm-hmm. But it moves the process through faster. So I can control it because you need the inflammation to heal, right?
Yes.
I don't know if you're familiar like with prolotherapy or some of those things, PRP and some of the other, but it's really about creating inflammation back into the cell. So you need that, but you need to go it through. So if I can control that inflammation, I'm going to get you better 50% of the time, 50% faster most of the time. So it's really important with athletes. We did a thing with the 76ers, Philadelphia 76ers basketball team with one of the chiropractors there. And we're looking at ankle sprains. So we got a lot of things to talk about. And we found out that 1 year ankle sprains compared to the next year we're using the laser, we only had a 10% decrease.
Wow.
We didn't do a really huge change. Here's the change. Instead of being out 8 to 10 days, you're out 3 to 4.
Whoa.
That's the killer part, right? And so if you're making millions of dollars, they want you back on that court fast. And that's really the thing. It's sort of like if we prepare your body for trauma, someone's going to hit you, right? You can protect yourself, right?
Absolutely, yeah.
But if you don't, then you can't. And that's what happens if you have imbalance in the muscles and ligament laxity or something like that from previous traumas. Yeah. You're not prepared, right? So we really always want to set that. I think that's really some of the big things that we get so much better as we reset you going out and then we reset you coming back in for the recovery process, right? Because you know that you've gone into this lactic acid huge buildup, right? So, I mean, it's pretty crazy some of the things you learn, about runners and other things and heavy duty athletes. They're producing a lot of what? Free radicals.
Free radical damage, yeah.
Yeah, they say that running a marathon, and maybe we can talk a little bit, is the equivalent of smoking how many cigarettes?
I don't know, Doc.
Would you think it'd be like a pack, like 20?
A pack.
Okay. No, we got to go a little higher.
2 packs.
We got to go a little higher.
5?
A little higher.
No, 8 packs.
A carton of cigarettes. 10, 200 cigarettes. It's so much free radical damage. So we see a lot of runners, right? We see a lot of runners that have cardiac problems, right?
Yes.
And heart attacks. Well, if you're doing that type of activity, or you're even going like a Ironman stuff, boy, you better be loading up some antioxidants, right? To really bind those up. And you better be doing a lot of laser, right? Because that laser helps do it. But really, that's the big thing, is that people don't understand that we really have changed, but really how much damage you're doing. And we see that in runners. Say, man, he's a runner. He runs 26 miles. He does these things. He's done 15 of them. Boom, he's gone.
And that's why, okay, I remember Salazar, like he was an old Nike's coach. I used to run a whole lot.
Mm-hmm.
And, everybody thinks that if you're skinny and you run, you're healthy.
Mm-hmm.
But the lead head coach of, this is back in the day, the Nike head coach, he had a heart attack. And he's a guy that's, trained his, he's running, 15 miles a day or 20, I forgot. And that's why, because there's so much free radical damage from damage to your cell. And so you could use laser therapy to actually help, prepare the body for that hit.
Absolutely. Yeah. So you have receptor sites, right? So think of it like a cell phone.
Yeah.
When I'm shooting photons in, it's going to max itself out, or like a sponge. I can only put so much water in that sponge. I can't put any more. Yeah. I can only charge my cell phone to a certain degree, right? And once it's full, I can't put any more in. Mm-hmm. But we really want to keep the maximum cell voltage on there. Yeah. And that's a whole different story, cell voltage. Yeah. Before they go out, and we want to have good muscle balance. So if they do hurt themselves, it's minor compared to the other. So you want a laser going out, prepare them, and then when they come back in, you're going to laser the heck out of them. It's really just one of those things.
So you're saying, okay, I love this. I mean, when we nerd out this, okay, so if you prepare, like, let's say somebody's going out to work out, you prepare and you increase the cell voltage. So you're saying there's a voltage on the cell, or how?
Yeah, that's a whole other couple hours.
It's a lot, I guess.
No, well, let's start a little bit. So yeah, let's look at us, right? So humans are electrical, the body electric. Becker. I don't know if you read that book. You got to have that one right there. Everyone's got to have that one.
Yeah, I have it somewhere.
I hear you. So we're electrical beings, right? Yeah. And we're really like direct batteries. We're batteries. We're not alternating current. That drains us.
Yes.
So when the body is electric, we actually have a gradient on the cells. So the inside of the cell, negative, mm-hmm. outside of the cell, positive, mm-hmm. right? When we're using the lasers and we're hitting that cytochrome C, we're creating a biochemical effect, which is increasing the electrical voltage on the cell. A healthy cell is negative 25 millivolts. As you age and we get towards the cancer and a lot of the things that are really bad, it becomes 0, right? So you don't have no voltage. So your cells can't work. And so things run rampant, right? They just run rampant. And that's the big thing part about it. So the laser increases the voltage on the cell, which makes it better. Now, if you're trying to repair and you're using some stem cells or you're trying to stimulate stem cells mm-hmm. for a temporary time, from my understanding, and I'm not 100% documented, I'm just know good people have been telling me that, you need it to be a negative 50 millivolts temporarily. And that's what the inflammation can do. Temporarily, not for a long time, temporarily. And you need collagen to get it. That's the bridge to get it there.
You need collagen.
And collagen. Collagen is one of the big bridges that allows the stem cell to get to where it needs to go.
Oh, man, this is...
So now we're getting a little of the stuff that you're a lot better at than I am.
I'm thinking, like, you increase the negative nature of the cell. Like, that's what the laser's doing. So you increase that gradient, you increase that cell. They go out, they exercise, they come in. You're repairing. So when they go out and they just work themselves, they have all that negative charge built up. Now they're ready to go. They go out and work themselves. And so now the cell's been able to like get rid of that free radical.
Okay. So free radical damage really hurts the mitochondrial DNA. It's 8 times more destructive than actually the nucleus DNA.
Oh,
It's so sensitive.
wow.
So you're really destroying your energy power cells, right? The gasoline. So that's what you need the laser to get the recovery to bring that back up. Okay. So yeah, so you're getting the thing. It's just, you're just plugging yourself back in with the laser. And so we know that red was great, but then when we added infrared has a different receptor. There's more research on infrared than anything out there, bar none. Don't kid yourself. It's out there. But that goes to where it hits the calcium ion channels, right?
Yeah.
And that's where it creates the ATP. So it has a different receptor. So 2 heads are better than 2. I want to get maximum receptor base, right? As many photons into the body and the cell. So we use both of those, which are really great. Now, 808 gets a photochemical, but it gets a little bit of photothermal. Right?
So you get some heat production?
Little light heat production. You don't feel it too often unless you're really inflamed, right?
Yeah.
If I go to an area that's really inflamed on you and I laser that using that combination, we're using the higher powered lasers because dosage is really important. And that's a whole nother subject, is that when you do that, you might have a sensation of heat, right? Yeah. Going, oh, that's hot. So I always tell the patient, okay, I'm going to be lasering here. If you feel it's starting to get warm, let me know. We can do 2 things. We can turn down the power or we can move it away. So if they say, oh, it's getting hot, Dr. Rick, it's getting hot, I go, oh, man, that is great.
So you're actually stimulating this.
Well, I'm stimulating because now it's diagnostic again. So that area is really super close to the threshold, right? And so pain is a C fiber of the nerve, right?
C fiber.
What's the other thing? There's 2 other things. Temperature. So the perception is it's hot. Believe me, their perception is 100%. They're not wrong. But when you move the laser from one area to the other, you're going to see it's really not that hot. So for me, I said, oh, that's great news. We know where you have a lot of inflammation in that area and we need to work. So I'm always trying to help the patient appreciate where the source of the problem is, right? You put it on a pancreas, right? Sometimes, which is a hollow organ.
Yeah.
Oh my gosh. People go, wow. I go, oh, we got the pancreas involved. You saw that a lot with COVID, right? It's like, but it's good. Now it helps me not sell the nutrition, but help them to understand the appreciation why they needed nutrition, right?
Totally. Yeah.
So yeah, it's used in so many different ways, but that's really a good one. So if you do feel the heat, that's good for me, and we just back it off. They're not going to burn. We're not going to burn anyone, which is really great. So that's really the important thing is we're going to pulse the lasers. We're going to pulse them. Okay. Yeah. So I think I was the first to pulse them. There probably was someone else or it was a random one. We're going to try 10. We're going to do 100 or something like that. But I was the first one, I think, to ever do precision pulsations or hertz. And that was because Dr. Rimhall has a lot of cool toys.
Yeah.
So we had a dark field microscope, and you will appreciate this. Yeah. So I take a little bit of your blood, and let's say it was a while back, right? Yep. Do a little prick. I put it underneath the microscope, and I go, guess you got spirochetes in your blood.
Yeah, spirochetes, like lime.
Lime, yeah.
Lime. Mm-hmm. And so you see it on the microscope. Yep. You see it on the film. Yeah.
Mm-hmm. I said, okay. We're going to laser you and see what happens, right? And so we really looked at different precision hertzes or pulsations. And when you get the right one, I'm not going to prick you 20 times, right? But it doesn't take me usually too long to figure it out. Yeah. 1 or 2, and we were using the biomeridian, which is electroacupuncture by bowl. Yeah. So it has a computer, 10,000 different things you can do. And then I laser you, and we come back 10 or 15 minutes later, and we take a little drop of that blood. And guess what?
No splatter.
They're not there.
Oh, heavens to Betsy.
Now, you can't, when you can see it and it's not there. Now, did I kill all the lime in your body? Probably not, but it's not there, right? Which leads into other questions. The lime can stay in their body for 3 years, but I'm telling you, we put a target on its back. Right. And that's the fun part is we put a target on its back by having that frequency resonate, right? So that resonation. So the first ones that we really looked at, though, was really doing more neuromuscular and pain things. And then we branched off into the fun areas, right? But really mainline, we love the laser for the wound healing, for burns, for neuropathies, for headaches and migraines, which I'm pretty much, I think I'm an expert in that category because I've taught dentists, how to treat them for 7 years, developed programs. And then we actually have a program up in New England that I work with Dr. Doug Wine, the New England Lyme Laser Centers.
That's amazing.
So again, we have these extremes. So it's like too good to be true. Like it's a Swiss Army knife, right?
Yeah.
But the thing is, you're creating energy. Our motto was, if you remove the interference, what happens to the body? It resonates and heals itself. So it's all back to resonating. Here we're trying to resonate with the audience, right?
Yep.
We're trying to really get the resonations. We know from, string theory and vibration and that. And really, I think it comes back to embryology, right?
Yes. Explain.
And so this is, this sort of carrot talk. He didn't directly teach me this, but he really got me thinking, going, he's sort of talking about when we develop, we have 3 layers, right? Endoderm, ectoderm, mesoderm, right? And then it starts with the capsule, and then it evolves and then completely changes. So the nervous system starts on the outside and then comes to the inside when we develop. Mm-hmm. Anything with the same birth date. So let's say on, week or day 21, we're starting to get the heart to develop, right? Well, guess what? At that time, what else is developing? The cerebellum.
Oh,
so the same birth dates are going to have the same oscillation, even though they're going to migrate. So the heart's here, the cerebellum's back here.
Oh my goodness.
So now we can, if you really want to get out there, we can use these precision, right, pulsations to stimulate different areas. And so this is really where we got a lot of the thinking came from, Carrick, and that neurology part, but really using the biomeridian, doing orthopedic neurological testing and tons of biomeridian. It took us a couple of years, and we're still doing it today, right? We're still trying to figure out different things as we get thrown new things, right? We're getting through things every day.
Wow. So anything, like you say, they migrate. So this would explain why, like if you're a doc and you go in and say, well, the heart could have something to do with your cerebellum, and the cerebellum could have a dysfunction. So let's say somebody has a concussion and knocks their cerebellum loose. They could give them heart problems because there's an oscillation between both organs.
Yeah, usually it's not a direct heart, but we throw off the vagus nerve, which controls the heart, right? Because it's a brainstem injury. Same thing, though. What stands the test of time? We have, acupuncture, right?
That's exactly right.
So what are we looking at?
I always feel like it's a huge electrical grid to me.
That's what it is. This is not the heart pump. It's the electricity the heart is producing that creates the organ. That the greater it is, the more we have distance that we're reaching out, right? So it's an electrical grid. Exactly. What are we using? We were using biochemical stimulation through a photon to create energy, to balance energy, and to cell communicate or sync, according to like Gilbert Ling. And because of Gilbert Ling, his stuff on the cell was amazing. I met Gilbert probably 17 years ago. Phenomenal. Yeah. But from his work, talking about this association induction, so things sort of line up or sync.
Yeah.
That's how Damadian was able to make the MRI based off his work. Damadian would have never been able to make the MRI. That's where I saw him. I saw him in Long Island, in the basement, in his lab. He's speaking Chinese. It wasn't as good as I would think, but he really helped me understand. Reading his books, to be honest with you, I could read them, but about 3 pages, like my brain is full. Man, I go home. It's
I couldn't imagine.
But we got to talk and the other thing. So I got the gist of it, right? And I'm just thinking, that's how it's working. That's how it's working. That's how it's working. And then you look at other people, they like, is he starting with the Body Electric and then James Oshman? We were really good friends. And
friends with James Oshman?
Oh, yeah. He wrote the foreword to one of my books and everything like that. So James and I, James, he's a good old guy. So that's really, so much fun. So we got James Oshman, we got all these great people really understanding about the living matrix, that we're cellular, and really one photon can create a cascade all the way down the line. And we know that there's a system faster than the nervous system, and that's through laser light communication in the body. All cells communicate through laser light.
All cells can.
All cells do it. We do it when you do EEG, where you put electrodes on your brain, right?
Mm.
And then you know that the fastest part of the nervous system travels 100 meters per second. That nerve,
Oh my goodness.
it's blazing. So that's an A fiber. The C fiber is much slower, right?
Yep.
10th of that. So you can put an acupuncture needle. So you put, you got electrodes back here. You put an acupuncture needle on the little toe. It registers in your brain faster than that nervous system could have gone. So we know, and the research is really coming about. We see it, we know it, and the research is catching up to us. But all cells have these little acceptors too, antennas. So we have receptors and acceptors. And a lot of this communication is through these acceptors.
Wow. Like there's antennas on your cells that can perceive something faster than it would travel through the nervous system.
Yep.
That is... Okay, so one of the things, and I don't want to get a sidetrack from what you're talking, but when you talk about the living matrix, like I remember you talking about matrix, and I've been trying to study that, like you say, resonance, because all our cells have some form of it's almost like it's not goo. It's just like they actually have lattice structure. So you're saying signals can travel through that too.
Absolutely. The myofascial system is it's just electric, right? It's that sheet around it that's just electric, right? Why do we have different brain waves, right? We got different waves for this. We have different heart rates. We have a whole lot of different things that are really working on different pulsations, right? So if we're sitting here, we have two constant environmental stimuluses that are constant happening right now, and I don't feel either one.
Why don't you? That's a good question. Because
I don't know. What do you think they are?
I would say light of some sort.
We got some light coming in.
Light, constant stimulation, gravity,
right? So if you go up, high dive, and you jump off, gravity's happening.
Yeah.
We got the Earth spinning. You don't even feel that, right? So gravity sets the baseline frequency of firing of your brain. Okay. Okay. So you got to really sort of understand is that when we really develop, right, what happens? So when we start to stand up, we start to talk, right? Our heart rate goes from 150 down to 120 and 100. 70% of brain's job is to slow things down.
70%.
70%.
Okay.
So we're excitatory, we're receptor-based brain. Now, the reason that gravity sets the frequency of firing your brain for the most part is because we have what we call tonic all the time, and phasic. As I'm talking, I'm doing a phasic joint, which is the TMJ.
Yeah.
And that sends more information to brain than any other phasic joint in the body. It's the big kahuna. Ever look at homunculus?
Yeah, homunculus of man.
Yeah.
It's the map of the extremities and such in the brain where it's located, right?
Do you see the mouth area?
I hadn't paid attention.
It's like 50%, right? The mouth is like 50%. Everything else is the other.
Oh,
so we have big pretension here. So that's a phasic, though. Okay, so I'm trying to stay on point here. So the tonic receptors are in your spinal column, your spinal joints.
Okay.
Those fire all the time, whether you're laying down or sitting up. So when you sit up and start standing, that's, again, the brain's developing. As it develops, what goes down? Your heart rate. What goes away? Your primitive reflexes. People that have trouble, right, brain injuries in kids with autism and learning disorders, guess what is still there? The primitive reflexes. So there's a lot of people in that world still, excuse me, looking at primitive reflexes, and I think that's great. My job is to bring them to a higher state and to balance it. Coming from the Carrick background, it was right brain, left brain, corpus callosum, and then cross crawl type of things. So I want to balance. Now, let's go to the other one, right? So we're not quite done yet.
Yeah.
Earth's electromagnetic field.
Yeah, you don't
feel that.
Yeah.
Why does it vibrate at 8.63, Schumann resonance?
Doc, I'm not sure.
I'm not sure either, right?
I guess
it's like an alpha wave or something like that, but I'm not sure exactly why, but we need to be resonating, right? So this is really where we talk about healing is that, all those, like Tour de France and those major athletes, and we see a lot of that today, is going back to grounding, right? Get yourself off the computers, get yourself back into that good resonance.
Yes.
Right? You get yourself good in the resonance. What happens? You start to heal, right? Now, We look at the cell. We talked about that. Negative inside, positive outside.
Yeah.
Do you think that resets it? I think it does.
Yeah.
Okay.
So
And that's the important thing. It's getting back into balance, being electric, right? Resonating at a high rate and avoiding a lot of things that are alternating current. Screens, 5G, being inside, not getting good light in the morning, not getting good light in the afternoon when the highest infrared is there, right? This resets your dopamine as well, we're learning, right? And dopamine oscillates at 100 hertz, just so you know, which is the same as gamma, right? So we just learned that out. Yeah.
So you stimulate gamma, you're stimulating your dopamine.
Yeah. No, it's not a direct one. So this isn't an exact science, but some of the things that we've seen, we're now understanding why we see it, right? So we always are looking to put the body back in balance. And so we'll really go with this and we'll give them little tidbits on how we do it, okay? Yeah. So there's a place that's 2 fingers below the belly button, right? That's an acupuncture point.
Mm-hmm. So I know it's on that central vessel.
Yes, the central vessel. It's also what? Part of the parasympathetic nervous system, which is brainstem, cranial, sacral. Oh, and it's also your core beliefs, right? And it's also the place where you can break a lot of neurological and emotional things. So I always start there, and I can check, so when you've had trauma, if someone comes up or I get hit or I fall or something like that, I go into a withdrawal response. So I'm put my hand on a hot stove. Yeah. Boom, I pull it away, right? So I got a chemical demobilization, those C fibers and everything like that. But I can stay there, right? Some people can't break that. So then you're looking at heart rate variability and the parasympathetic and the sympathetic working, right, together. So now I'm in a little bit of sympathetic escape or response. And sometimes it doesn't break, right? So we need to have that. So we always have to go back into really put you in a parasympathetic response. And so that does that. That breaks the withdrawal response. And then we've heard so much about the vagus nerve stimulation, which is huge. We use that with a laser quite a bit. But then I even start higher because really the top of your parasympathetic nervous system is the Edinger-Westphal nucleus, which is near-far gaze.
Near-far gaze?
Yeah, so we're going to do near-far gaze. We're going to maybe put a little Reezy on you, resonate you a little bit while you're doing it, turn your head, and then near-far gaze. Really important. When I check people with this, I look at their palate and look at the tone of it. Part of my examination, I'm looking at this near-far gaze. And an athlete, an extreme athlete, let's say the ones that I've seen the best ever that could do the maximum amount of near-far gazes without fatiguing or blowing out muscle testing is usually figure skaters. They're just unbelievable because they have so much space. And the other thing, I mean, they can look at something and the other thing like that. They're unbelievable. My average patient can do 3 and then they fatigue.
Just it, 3.
3. Look at my thumb. Look away. Look at my thumb. Look away. 3 and they blow out. Watch them. They'll get some nystagmus in the other. So I like to start at the top, right? So we have 3 parts of that brainstem. Top, middle, lower. Mesencephalon, pons, medulla, right? Understanding the vagus is the big kahuna as far as the healing of the parasympathetic. It is the vital center. If you have trauma to that area, you die within 2 to 3 minutes. Okay, major trauma. So it controls your heart rate, your breathing, your digestion, all sorts of different things. So we know it's really important. When you stimulate that, we decrease the bad cytokines, right? We increase the good bacteria in your gut. So there's so much that we're doing in Brazil with animals and that, really finding out that 10 minutes of lasering the gut increases the good microbiome.
Wow.
5 minutes on gamma, the frontal lobe, increases blood supply to it. So we got a lot of things going on. So again, we're giving you a lot of information, but how you use it may be completely different than how I use it, right? Yeah. Just like, we're here in Nashville, if we wanted to get to Florida, right? A lot of ways to get there. Yeah. But we're still going to get there. So the laser to me is always an extension of your knowledge, right? If you know this acupuncture point with this or this balances and you use these points to do that, boy, that laser is going to get you there because it's working on the cellular level, right? And that's the key. We're really getting that harmonic, that resonant at the cellular level. And that's why we get profound results. The things we do with nerves and a lot of things, in your normal Guyton anatomy physiology
Yeah.
book say it can't happen.
Yeah.
You can't do that.
Yeah,
And yet we do it
it's
all the time. Right. I mean, it's like if we repair, not only the peripheral nerves, but we repair several severed nerves, right, as well. So I got great cases on facial nerves that have been severed. We send them to the best people in North Carolina. It's the Facial Nerve Institute. They do one thing. The facial nerve. That's all they do, right? It's a devil like that. They come out and say, oh, you don't expect to see any feeling or any changes in 12 to 16 months. And then this and that and the other thing. In 5 months, I got them 80% better.
Oh, my goodness.
They've lost complete motor, sensory. Their eye is tearing. Their mouth's all messed up because they got scores because they can't open their mouth. And that's one of the branchial cranial nerves. And these things they say can't do. And it's just like laugh. And I don't know. To be honest with you, you don't know.
Yeah.
Because it's not like you put two wires together and that's what they do. Right. And then you take some electrical tape. They have to regrow. They have to be neurogenesis. They have to reconnect themselves. So it is sort of an unknown. But I have a pretty good feeling, and I've never been wrong on one. Some takes longer than others, but I usually can bring those back pretty quick.
Well, the one thing that really amazes me is that when you're talking about like waves and facial nerves, because I mean, it hits home because like my mom's had, which thankfully she didn't lose a lot of facial features, but with the things you've told me to do, like even because you're so intuitive, but you were just telling me like, you need to hit this and use this on the laser setting. And I noticed though that my mom's like face even had different movements after you know what I mean, like stuff I hadn't seen before, like different motion.
Yeah, and we've been talking over the phone, so we can give you some tips of what I thought was going on, and you've been doing it. So I think we had a little bit of some things we had to clear with COVID still in there, even though it's really coming from the stroke, but it was really coming into where we're setting things up, and that's where you get the biggest joy in life is when you change their affect, right? So now they're humming. You said she's humming. Oh, they start telling you jokes. They go, oh, is that painting new? Is that thing like that? Oh, boy, that secretary, she's so nice in that. So when you start changing their affect, that's the one that gives you the goosebumps. It's like, oh, because they're in survival mode. They're going from A to B to C and hoping they can get back to B to A. And you can, so you can break these things in very fast. You saw at the end, it's sort of like we set things up. We did body balance, we did vagus nerve, we did button thing like that. At the end, we knew that there were some sensitivities in the heart region. Do you mind me sharing?
Yeah, I love it.
Okay, all right. I just want to make sure. But we knew that where the stroke was, right? Where was the stroke?
It was at the right basilar, like right here in the lower, the upper area, right below.
Right.
Yeah.
So the last thing we did that cleared the room was we came inside the mouth, right? Because the thing we didn't want to put the nasal didn't put the nasal probe on there and do it. Yeah. We just had her open her mouth, and we didn't want to keep her for that long. I don't think it took us 30 seconds.
No.
Flipped it. You could tell we just flipped the switch. Everyone in the room could tell that we flipped the switch.
It was amazing when you said open the mouth. He goes, no, keep it open. And it was just like, you could tell there was a shift in how she performed.
Yeah. It was like 30 seconds. So again, it doesn't take long. Now, normally we want to get 120 to 162 joules is really the thing that we're looking at. But you don't necessarily have to do that, because again, it's about reconnecting, especially in a stroke. So you've had damage to an area of the brain, the central nervous system. Mm-hmm. And usually when that damage is done, those cells don't come back.
They don't come back.
We know some in the hippocampus, and then we're learning some do. So when they don't come back, we have to reroute, right? So we can't use the airport. Oh, I want to go to Florida. Well, you can't go to Nashville Airport here. You can't get over here. Guess what? You're going to have to take a different way. And that's what we're doing. But sometimes those pathways are very viable, and it only takes the laser decreasing that inflammation and cell signaling to connect that. Right.
Wow.
So that's when you get the wild ones. When you're not getting that, and you've been treating her for a while, so you were close. You really had a lot of close. So we just really connected that last part. So again, we talked about this as sort of like going through the jungle, right? You have a machete. You're going through the jungle, you're working your way up, and you're trying to see what pathways are viable. And we want to laser the heck out of those pathways and do activities, whether it's brain activities, whether it's movement or what have you. And then we're going to do it. So the more we do it, that pathway becomes wider and wider. And then we call that neuroplasticity.
Wow, because neuroplasticity would be like they can create new neural pathways or neural nerves.
Yeah. synapses, connections. So that we're looking at, right?
Yeah.
So that's what we're doing. So we can create those synapses or connections. We know that we're off to the races. So then once we have them connected, we have to keep driving that system to create more synapses.
That's okay. Okay, so Doc, like you saw in like, so many seconds with my mom. Like I mean, and amazing. When you're like working with facial, you said 6 months, 8 months, and I know that everybody's different, but you working with like stroke victims, cerebral palsy, you had these. I know you've seen some like but did they ever have like an average amount of time, like, because you were doing such, like, because I know different laser therapy, different protocols, did they have an average amount of time that you saw like some big changes in?
Well, I'm usually looking at minimum 3 months, right? But some things I'm going to find, some pathways to some highways are open, right? And so that's what it's at. Now, if it's a TIA, right, not a hemorrhagic stroke, it was just ischemia, and we have inflammation, those can be just quick. I mean, like you see changes in like first visit. And that's the thing I love with the laser. I can promote changes in the first visit many times. Not necessarily all of a stroke. Their hand isn't going to come back. My brother-in-law had a stroke. I mean, it took me 3 months to get his leg to come back. Really, took me 3 months, and I got him on the laser. I got him on a, nerve stimulator. I got music in one ear and not the other. I got him doing exercises on the pad, and then I'm sitting there in the office, and he had to move in with us. And then my wife goes to start screaming at me. I'm thinking, oh gosh, what's happening now? Rick, come here.
What happened?
So she's helping with the therapies, right? And so she said, it's freaky. What happened? I said, well, show me what happened, right? So he was trying to get out of a chair, right, after doing the therapies. And when he went to get up, his whole leg shaked. I mean, like violently. I'm going, oh, that is so cool. We just connected the nerve, right? Because it was dead, right? It wasn't working at all. So I knew we had the pathway that we connected. But I had the laser here on a stand for 25 minutes. Well, I'm doing it. I mean, I got to going pretty good. Yeah. Now you're going to lose some going away, but I was doing other activities with it, and you don't want to exceed their metabolic rate. It took us a while to work up to that. So then we go to the PT like a day or two later, and she's like looking at me, sort of like what you're talking about, right? Yeah. What'd you do? Right? What happened? What'd you do? And she's going, well, he can do heels. He can lift his hip. He can do a heel strike. He can go foot flat. He can go off his toe.
Oh, my goodness.
She's blown away. He's blown away because he's seeing things he hadn't been doing because he was doing this big old swinging of that hip, right? He's lifting up a little bit. Still has swing in there. I'm not, getting everything. But I'm telling you what, it's like she's going there. She starts getting emotional. He gets emotional. She's crying. I'm crying. Everyone's crying a little bit. But it was phenomenal once you reconnected it. But again, that took 3 months. So everyone's a little bit different.
That is...
And so there was such a huge tumor. I mean, such a trauma to it, that area, we couldn't bring back the hand. I never could bring back the hand. So it just depends on what you're dealing with and how fast. But his was really bad. They didn't find him for 3 days. He laid on the ground for 3 days where they found him. So you look at his MR, it was not good. But his cognition came back. His affect came back. Again, he started telling jokes. He was a jokester before, but he was not himself. So when you see their affect change and then they become themselves, that's really cool.
It is true. I like seeing, like with mom, like just using before really meeting you, I using protocols I've seen in your manual, and then you doing that and seeing my mom like hum and laugh about stuff and just saying, she was like waving at everybody, and you see like some of that old personality come up, and it does your heart so much warmth. And I think that given like even my mom, like seeing her like move and like initiate leg movements, like before, like she'd have to swing her leg outwards, but then they got her PT would say, hey, what's been going on? I was like, because now she's literally hiking her hip up to put her foot forward, and they're like, whatever you're doing, keep doing it.
Yeah.
And it's a new wave, because I'm going to say this, we're going to have more times with you, but I'm going to say this with laser therapy, like what you're doing. And we want to hear about you and your clinic, or how you operate. And I know that we want to talk about the future of laser, because I know it's the sky's the limit pretty much, but where do you see it? Like, is it what's going on with like the future of it and stuff?
Okay, so I think the two big things happened. I think about we're just about full through the decade of the brain, right? The nervous system, really understanding how the laser works for treating brain is really an important thing. We see so much research in that over the last, maybe not 10 years, but 7-8 years for sure. And so we're treating, we have these great clinics like Dr. Motley seeing 10,000 patient visits treating autism and brain things. We see Dr. Kelly down in Florida, Save Your Brain, right? We see so much brain. We see Dr. Madsen and these other treating just autistic kids. I mean, unbelievable, right? And just using the protocol, treating autism, treating pans and pandas and the things that are happening here. It's just unbelievable. So the brain has exploded. And this is mostly from what people tell me. I don't know this for sure, but they say the number one research or Google thing on health is brain health. So I think brain health is going to continue to grow. Now, the cool thing I think is, so that was cool, is that we have this new era with COVID, right? So whatever you want to say with it, but COVID really changed the way I look at people, right? So I'm looking at orthopedic neurological. So I do those particular things, and then I put on a new lens. The COVID lens.
That's what I'm saying. Like, what lens is that?
The COVID lens. So I'm looking at, okay, so if, you got attacked and those, ACE2 receptors got attacked in that, what am I looking at? And I've seen it treated enough COVID, acute, and long hauler to really have a pretty good idea what I'm going to see upon examination. Or if I do like a neural check and I'm looking at different organs and heart rate variability, ask me where things are going that I haven't really seen in the past. With COVID, there was so much trauma to the lungs, right? Especially in the beginning ones, people going on ventilators and all sorts of crazy stuff, is that we started lasering the lungs for multiple different reasons, right? The healing aspect, number one, and then red and violet both have a very systemic effect, right? We haven't talked about violet much. So when those lungs were being attacked, it creates scar tissue. Now, should the lungs have any scar tissue in it?
No.
They need to be what? Super elastic.
Exactly.
Right. So we're seeing these studies saying, hey, when we saw this, we started lasering them. And guess what? Their elasticity was better. Their oxygen saturation was better. And wild things, it's really saving them from going onto a respirator. Right. And they were getting like 99% success rate. I mean, it was phenomenal. Phenomenal, absolutely phenomenal. So then we had that acute stage. Then we went to the chronic stage. So we went to the long hauler. So first thing with a long hauler, people tell you, I got no energy. I can't get out of my own way. I can't get out of my own way. I can't get out of bed. I can't do anything. And then we started to see, obviously, some of the brain stuff, right? Neurology and the cardiac, right? So we know that their pericardium and their heart were very, very inflamed, right?
Yeah.
Well, there's a lot of ACE2 receptors there. Small intestine was almost always off. I don't know if you check that small intestine.
It did. I was like,
it's always off, right? Yeah. So that's where your nutrients absorbed, right? Yeah. So your small intestine is off. You can't really absorb any nutrients, which isn't very good, right? So we got the cardiac, we got the brain, and then so we know we got the brain, we got the gut.
And so we
got the gut. You cannot have it, right? Yeah, you cannot have any of that. So then we got the neuromuscular component of it, right? So we got the neuromuscular. So all these systems are being under attack. So when I say put on that different lens, let's say that I'm just treating, on a rare case, I get just a pain patient, like, neighbor hurt themselves or something like that. I go, oh, the pain, that's easy. Put one end of my bed. We're going to get that one. That one's easy, right? But they don't get better, like when you think they should. Ooh, let's put on the other lenses. Yeah, so then we have their lenses, and then we take the violet, we take a different, instead of using a pain frequency like chronic pain or muscle balance or something like that, we start going to the thymus first, putting the thymus in, saying this is an immune component. I just did a really good webinar on that a couple months back. So there's an underlying immune component because we're seeing this huge rise in autoimmunity. Huge rise in autoimmunity. Wow. Unbelievable, right? We're seeing, in heart attacks, cardiac, and the other things. So I go, okay, this is neuromuscular. I know the other things going on. Let's treat it from immune response in combination with what I'm doing. And guess what? opens that safe to it.
Mm.
Click, click, we got the code, boom, opens up, and they just phenomenal.
So it opens up the safe.
Opens up the safe, the range of motion comes back, muscle strength comes back, pain goes away.
And that thymus gland.
The thymus is the master immune gland, supposedly, that's they tell us. So the thymus is pretty much mediated by the hypothalamus. So for me, I look at the big ones for me is obviously hypothalamus, thymus. We do have something in the tonsils, the adenoids. I usually don't do that unless we do a little bit and we had something there. And then the heart. I think the heart is part of the immune system. That's my thing because it's electrical.
It's
right?
Electrical. So you put the heart. You
got to get the heart going. You got to get the electrical going in the body, right? If your battery's dull, right, you can't get anything. You can't. You're just not getting anywhere, right? You're really so low. You're such a slow charge. So the heart's always a big one for me. And then the spleen, which is really processing all the blood and filtering it, was such a huge load. Huge load. Spleen in the beginning. So I'm really looking at the spleen. And then we have the bone marrow for stem cells. Oh. And then we have the gut.
Yes.
And we're learning that if you laser the gut for 5 or 10 minutes, right, you're going to increase the good microbiome, decrease the bad cytokines, increase the good ones. One of the studies out of one of the ladies in California, she was saying after COVID, and they did fecal samples and everything, that you decreased your microbifida by 50%, 30 days.
Heavens.
Yeah. So how's your immune system doing?
Horrible.
Now, horrible. Then the next 30 days, it went down another 25%.
In 30 days?
In 60 days
60
now.
Days, I mean,
yeah, 60 days. 75% gone.
Wow.
Yeah. So you got to clean that stuff up and get back in there and doing it. So if you don't, the immune system is really so important for that. And then I'm always looking neurologically. We used to think that 70% of the serotonin was made in the gut. Yeah. They're saying as much as 90%. So you're not going to feel good, that feel good neurotransmitter unless you're getting the serotonin coming back. And that's going to take care of, multiple different things. So we really are looking at the serotonin for the brain stuff, especially laser the gut. So it's really simple for me. Body balance, vagus nerve, reset the gut. You have 100 million neurons going from your GI tract up to your brain. Yeah. That gut feeling, it's real. Right? It's real. 100 million neurons and talking to yourself going, alarm, or something like that. Something's got something going on. It's not good. And then we go to brain. That's sort of how I approach it. Right. So those are the things that we really like to look at, but it's really not that hard. You have to be in a healing state.
Yep.
One of the things, even when brim halls, I would always check to make sure we were in the desert. In desert, you're supposed to have less allergies, but I'm telling you, there was a ton there. Is I would check that reflex point, right? The allergy reflex point, which I was in the palm. If they were there, first they were electric, right? You had to make sure they were electric. And then you check that point, and if they were in the allergy response, I would never treat them before I went on. I would clear that first, right? I would treat them, but I wouldn't go any further. That means their heart rate's up. They're in a sympathetic tone. I'm working backwards. I don't like to work backwards, right? I want to work smarter, not harder. So I would clear them. And that's one of the things that we created way back then with the lasers. We call it an assert program, right? So we took different vials and we worked with, a lot of different people to create our own kits and that. And you clear them. Yeah. But the laser works at the cellular level, so we clear them really fast. Now, let's go a little wilder. So anytime you have an allergy, right, there's an emotional component to it.
Really?
There were studies, I believe at Harvard, and it's been a long, long time. I think Toby Watkinson really helped me understand this and appreciate this. So they take people and they would put them in clean rooms.
Yeah.
Pull their blood. Oh, no IgE response. You're looking good. Everything's looking good. They would show them a picture of grass, wheat, or smell, or some flower, or something like that. They come back, take the blood. Guess what? IgE.
No.
Yep.
So the emotion of them seeing that.
Just that physiological turned that back on. So when I'm treating an allergy, and we're getting way off subject there, I always treat an emotion with it, right? So I find out what the emotion is. And so I love those chakras, right? So it's usually breaking a chakra that's really down, right? So we have a chakra imbalance. The laser can reset that really quick.
Wow. So
and then you can use the eyes. There's a lot of things you can do.
Okay, so this is what we got. Like I'm telling you, like the audience would love for us to, in the future episode, we got to do like allergy and emotions.
Emotions are fun.
We got to do that, okay?
Your mom had a little motion. We hit that one pretty good.
Right. That's like when my mom, like, you could tell, like, she internally, like, with her separation, like, feeling abandoned and such. So because that's what people will love. They love this kind of thing too.
We kept coming back to her heart, right? Didn't we? You got a laser heart. Her heart was affected by COVID, but there was also an emotion component to it. And it was separation from family and friends.
Totally. And that's like, whenever I see her now, like I try to always even more like, hold her hand, say, you're going to be okay. And then she like really lights up after that.
Yeah.
Man, Doc,
that's a whole different seminar.
This is a whole different seminar. This is, guys, I know this is a lot when we come into, we're going to digest this, and Doc's going to be on our podcast even more in the future. Because this is what I think. Not only like the physiology of the laser, but I would love to talk about certain subject matters, because my heart of hearts, like you're expert in migraines and headaches. I'd love to dive into that the next time we get to talk.
That's a great subject.
Migraines, allergy and emotions. Mm-hmm. And that next time, guys, I'll probably have a better, like my studio set up. Like, I'm sorry about that, but I'm glad you got to hear Doc talk. This is amazing, Doc. So when do you think you'll be next time?
I usually like to come every couple months, about 3 months if I can.
Okay.
My mom's just turned 86, so
that's awesome.
So
you can come down every 2 or 3 months. We can.
I try to. Yeah.
Okay, so whatever. This is like be great. Where can people find where you're at? Because I know you have like your research and online.
Yeah. So right now at drrichardamey.com, drrichardamey.com. And so brand new. So I'm in transitional phase. So I'm not seeing patients anymore. I've still been teaching and writing manuals and doing webinars for a long time, but I'm really transitioning. And so I'm cleaning this slate, and I'm coming up with newer, faster, better ways to use the laser for treating everything from neuromuscular pain to headaches and migraines to neuropathies. Neuropathies is a huge one out there. People have neuropathies. There's nothing really for them in the medical community, and this is so easy. And we got to give them some help with that. And then we see this huge amount of toxicity. I don't know about you, but I see so much of what we're calling COVID long hauler, and I see so much mold out there. Mold is just, we're being bombarded with it everywhere. And I don't know how it's getting there. I know, even in food, right?
It's just everywhere.
You can have, and lots of times it's the storage of food, but they say that you can process food and mold's still on the other end after it's been processed. It's nasty, right? And I was doing something like that. So I'm redoing a bunch of different things, and I got to come up with new, faster, better ways to do it. And so we're going to revamp some things here coming up.
Well, I want to show you guys too. We got this laser that Dr. Amy here is developing and such, but Can you say a little bit about this?
Yeah. So I've been training doctors for, 25 years now. And I've probably trained over 30,000 different doctors and team members on laser therapy. But I didn't believe that there was laser technology was good enough to have a home laser. Mm-hmm. We see a lot of red light therapy, and red light therapy is great, but it's not like laser. Right. Red light therapy is a bicycle, laser still Ferraris, as far as I'm concerned. So great analogy. You can get there how fast you want to get there, right?
That's exactly right.
Well, I want to fly first class. Well, private's probably better, but first class works for me, and I'm going to take direct flight. So I've taken a stock laser, right? So just like with zirconia in the beginning, they didn't have a clue what their laser did, right?
Yeah.
They're engineers.
Yeah.
Engineers are not clinicians. Clinicians are different. So I started creating those precision pulsations so that we know red is huge as far as the literature, right? And I was raised on red, so hard to go against that core belief. And I believe that is the chakra is red. And then we have infrared, right? Those are the two most researched laser wavelengths out there on pain. Over 5,000 peer-reviewed articles on pain using red and infrared. So that combination, different receptor sites, we want to get both of those.
Yeah.
So we have red, right, in here. So we have really these diodes here. So we have 6 and 6, 6 infrared and 6 red. Okay, and we'll turn that on in a second. And then we have this little strip here, which is a combination of microcurrent and TENS.
Wow.
No one has that either.
No.
So we have this first setting right here, which is 1, where those are all my precision frequencies. So my essentials, let's say my top 20.
Top 20.
Top 20, right? They're in here. Wow. And then I throw a couple extra ones because I just added a couple for COVID and an extra brain one for some of the things, I think, because of mold. Yeah. So I added 2 new frequencies into this particular one. So you just turn it on, you hit the button. So that's really the coolest part is you turn it on, you hit the button. And when you do that, you can see that it's pulsating, right? Can you see that it's pulsating?
Yep.
Yeah.
See it.
And that's the thing that no one else has, right? So you get all my clinical experience of 25 years of the best pulsations, precision pulsations in there. And it rotates through. So instead of having going into program, which we have in the Avants, which are great, phenomenal. I got 250 presets in there.
Yeah.
This one is just point and shoot, but I still do it the same way. Reset the nerve, go to the area, and then do some movement if possible, or use a modality. Right? Use some other things. But the cool part about it, because you don't feel the laser, people say, well, I don't really feel it or it feels a little bit warm. We have this other here, which is microcurrent in the first bar. And this is great for that vagus nerve stimulation, right? Oops, sorry, turned it off. Yeah, we did a little bit of that with you, didn't we? And you can feel it. So you turn it on, and you come to the vagus nerve, and it's nice because you have this nice big band here. And then the microcurrent's not too bitey. If you're on the 10s, it can be a little bit of bitey. So I like doing this, especially you can do different things, but breathing is the key. First thing in life, you need to breathe. And we're stressed and people are not breathing through their diaphragm. So you're using accessory muscles like I can see that I've been using mine, right? And then that causes what? It causes some restriction of blood flow and this vagus nerve. Right? So we always want to put them into it. So I love breathing. I like to breathe in through 3. Hold to the count of 5, and then hum out. Stop, hold your breath for 3 more seconds, and then repeat. This is really powerful. Now, I gave you a little other toy the other day that we used right here for that.
It was the Resi.
Yeah, the Resi combination. Man, I'm telling you, you're going to light up that.
It lit me up. Like a Christmas tree.
Yeah, man, that vagus nerve stimulation is phenomenal, right? And so again, that's what we're trying to do. We're trying to put them back into that healing state. And then once they're in that parasympathetic portion, so we're doing the below, right? The sacral parasympathetic, plus we have the acupuncture point, plus we're breaking withdrawal. Then we come up the vagus, so we're trying to send the signal, those 100 million neurons up to the brain. And then we're sending a signal back down, and we're humming, which is the palate and the vagus nerve. So really, really powerful. It's nice. It has a nice little tingle to it.
It does. I was just playing around that because it just...
My legs are tingling right now.
Yeah.
So I could feel
down my neck and such like that. It was so good.
Because you can feel your body go into that parasympathetic, which inhibits that sympathetic nervous system, right? Which is controlling too much vasodilation, usually to your extremities. That's more when you're in that fight or flight, and we shouldn't be in a fight or flight. So, but yeah, that's the cool part. And so those, as you can see, it's going much faster now.
Yep.
Okay. So those are the precision frequencies in there, what I call pulsations. Frequencies are really the time between it. So it's pretty darn cool. And then if you have a big muscle, like say my trap or something, I can come into there and I turn it on the 10s part and you're going to feel that trap go. Works really great for cervical discs.
Cervical disc.
I have people that have cervical discs, right, which are hard to treat, that take the laser, take it home for a couple of weeks. And I'm telling you what, they couldn't sleep. They were in so much pain in that. In about 2 weeks, we pretty much knock them down, probably about 75, 80%. So this laser is $1,500, right? Where home lasers haven't been very good, right? So you see a lot of things out there. So it's sort of what's under the hood and not what's in the casing, because there are casings that look similar to it, but it really is sort of the difference between, an M series BMW and then a standard. Both are good, right? Yeah, but they look the same, but they don't move the same.
That's why I already have friends that want to buy this, so we'll get that. But this is, to me, it's I love that you have the microcurrent tens combination, and I just so impressed. And
then we got this little thing here so you can strap it, right? You got a little strap. So if you want to strap it to your arm or to your shoulder, you just strap it right there. Have a little Velcro straps, put it in there, right there. For the neuropathies. That's what I do. I put it on the leg. Put it on the legs. I strap it there. I usually a Reezy or something like that, or I do another nerve stimulator. That's great. So I get that constant flow. So the laser really is the setting of it, moving the inflammation through, increasing cell signaling, right, which is really important, increasing energy to repair the nerves, and it's phenomenal for repairing nerves. And then we're getting that stimulation so they feel it too as well. So really, really fantastic. I love using the laser with other modalities. I use it with PMF. I use it with shockwave. I use it with a lot of different things. But those are expensive.
No, they're
expensive. Mine are really expensive.
30, 40 grand.
30, 40 grand, right? So for $1,500, I can have a tool that can do things for pain syndromes. I can stimulate the immune system. I can stimulate the cardiac, right? I can do wrinkles for all the women out there that want to do wrinkles, and the men. I do it myself under the eyes. I got to do a little bit more, but that's really, really important. Wound healing, burns, phenomenal. So there's so many uses for it at home. I got a little grandchild. Oh boy, at 2, I thought they were going to take us in. She would fall and hit her head more times. They say 100 times by 2 or something like that. I think she made the curve for someone else, right? I think it was over. I'm a laser for it all the time, right? And so I don't need a big, powerful laser, right, for that one. But the good part is there's more milliwatts in there than an average laser. We started out with 10 milliwatt lasers. Yeah. That one's 20 times more powerful than the ones I started off with 25 years ago.
Wow.
So you got enough power to really hit what they're talking about as far as the proper dosage, right? That's in the literature right now. You get 2, the red and the infrared, which are really fun. Then you get the stimulation too at the same time to really drive that nerve.
I tell you what, well, Doc, we need to get on the show notes, the captions. Mm-hmm. We'll put this on there on your link.
Yeah.
Okay. And because I'm using this already. And I can't wait. Even with my mom, I was doing that. I'm to strap it. I didn't realize that the strap should put it on there for that. So this is amazing. And
it'd be good for her hand down here.
Yeah.
But,
put on the forearm
mm-hmm.
and get that rolling.
Yeah.
And Doc, I'm telling you, when you come back in, we'll have a different little studio set up, even more. But this was so fun. And guys, if my sound, you can't hear me that well, you'll be able to pick it up. But we got to hear you loud and clear, which is what I'm glad. I'm so thankful.
Good. Yeah, we had a lot of fun.
It was so fun. And guys, just check out drrichardamey.com. And also, too, you can see on my Instagram, you'll see his. I'll post some things that he has. Brilliant. He's been with Howie Cohn, done some things with the Biostacking Summit. So, guys, check him out, and we'll have him on again. So if you guys have any more questions about lasers and laser therapy with stroke, cerebral palsy, things, send us a comment in the comment section. That way we can ask the doc about it. Maybe we can have a Q&A for him.
Yeah, I think that would be great to have a Q&A.
And probably be good if we stacked up some questions, because I know some people out there have some neuropathy. They have these pain questions, and that would be really fun. So guys, like and subscribe. Remember, follow Dr. Amy here. And then if you guys have any more thoughts, send them our way. We'll get this to him. All right. So guys, until the next time, from all of us here at the Ancient Health Podcast, thank you, Dr. Amy. Appreciate you.
You're welcome. No, it's a pleasure to share with you.
All right, guys. See ya. Have a good day.